So getting back to other third trimester concerns, Group B strep is another third trimester concern. And here's the deal with Group B strep. Group B strep's a bacteria that's commonly found in the intestinal tract. So it's like in your intestines, it's in your throat, it's commonly in the urinary tract and in the vagina. And the problem is, many Western medicine docs and a lot of hospitals have rules and regulations around Group B strep because there can be complications and can cause problems with the baby's eyes and things if you deliver and you have an active Group B strep. Now, from the natural birthing community, we think that this concern is really overblown. And here's the deal, they screen for Group B stress sometime between week 35 and week 37 of pregnancy. Group B strep is something that commonly comes and goes, is present at times and then not present at other times in the vagina, throat, urinary tract, intestinal tract of women. And so depending on what's going on in your immune system and everything else, it can be there one day and gone the next. And so the standard medical model of care is that if you test positive for Group B strep between, when you're tested sometime between week 35 and 37 of your pregnancy, they will hook you up to an IV and you will receive IV antibiotics the entire time you're in labor in the hospital. And that's something from the natural childbirth perspective we'd want to avoid at all costs because that changes your intestinal flora and it also affects the intestinal flora of your baby before it's even born. And the problem with taking antibiotics is antibiotics reduce change the bacterial flora in your intestine and will often cause yeast overgrowth or other pathogenic overgrowth due to causing this imbalance. It knocks out not just the bad bacteria in your intestines or the rest of your body, but also the good bacteria. And so, I don't know how much you're familiar with, um, you know, there used to be this whole germ theory. This was kind of the belief until the last 15 years or so, and that is, if you avoid germs and you eliminate bacteria and viruses and you wash your hands a lot and you sanitize, that if you can avoid germs, bad bacteria and viruses and things through being very sanitary, that will prevent you from being sick. And the reality of the situation is you actually have about 16 trillion cells in your body that have, your DNA, and you have about 10 times as many bacteria, both good and bad, and yeast, good and bad, and viruses, good and bad, and that your intestinal flora is really a biome. It's a balance between your entire body, is a balance between good and bad bacteria, and maintaining a healthy balance is really what it's all about. And your intestinal tract is your primary line of defense, is your primary line of defense against disease. And so, to the extent that you're damaging your intestinal health and altering the bacterial flora in your intestines, to the extent that you're actually putting yourself at risk for becoming sick. And from the point of view of your baby does not have an intestinal flora when it's born because it's been in a sterile environment inside of you. And so the first exposure that your baby has to any kind of bacteria or yeast is when it comes out of your vagina. And guess what? That's really important that your baby be inoculated with your vaginal flora as it comes out through natural childbirth. They're finding more and more that a lot of issues like ADHD and can be, and even autism, are caused either, at least in part, by a problem with the intestinal flora of children. And so if you want to make sure your child has the very best possible start in life from a immunity point of view, you want to make sure that it really that you have a natural childbirth and your baby has the opportunity to be exposed to your natural bacteria and yeast flora by being born, through the as it passes through the vagina, it'll be inoculated with your flora. And guess what? When you pass along the colostrum and immunity to your baby through breastfeeding, you're actually inoculating it and providing your baby the antibodies so that it can process and really develop a very healthy intestinal flora. So introducing antibiotics into your baby before it's even had the opportunity to do any of that is not a good idea in our opinion. And so we try to avoid having to be hooked up to IV antibiotics, and so that's something that you want to consider. We go into this a lot more deeply in our childbirth, both our childbirth video as well as our natural pregnancy and childbirth ebook. But there are some definite steps that you can take to make it less likely that you're going to test positive for Group B strep. And if you do test positive and you wish to have a hospital delivery, there's some tactics you can use by like delaying going to the hospital as long as possible, because the farther you are along, the less likely you are to have interventions pushed on you, as well as you'll be exposed to the IV antibiotics for a shorter amount of time and they will do less damage. So anyhow, that's the scoop on Group B strep.